Okay, here's my audience.
Half of American adults have periodontal disease. This is a study from the CDC in 2009 and 10. It's called The Prevalence of Periodontitis in Adults in the United States. As a dental hygienist for 6 years, I can believe this because I've seen it so often in my practice. And anyone in the audience who has teeth is at risk for this disease. Today I'm going to explain what periodontitis is, what risk factors can cause or are involved with periodontitis, and what symptoms can be seen with periodontitis. So first, what is periodontitis? According to the Comprehensive Periodontics for the Dental Hygienist, periodontitis is defined as clinical attachment loss with subsequent bone loss. What does this mean? Clinical attachment loss is where you lose the gum that's surrounding the teeth, and then you also lose bone around the teeth. So that is actually what periodontal disease is where you're losing your gum in your tissue and your bone around your teeth. And out of the color atlas of the common oral diseases, I'm going to show you a couple pictures of what periodontitis looks like. This top picture here, you can see this tooth here in the middle. This is early periodontitis. You can see that there's some gum recession. This gum is pulling away and makes this tooth look longer than this tooth here. It's not really longer. It just appears that way because you can see the root of the tooth. This picture down here, this is a little more serious. They do have the gum pulled back a little bit, but this is deeper gum disease. You can see a lot more of the root there, so that's a little more serious gum disease, probably moderate. And this is severe gum disease here. They lost quite a bit of bone and quite a bit of gum tissue around the teeth. So now you know what periodontitis looks like. So I'm going to tell you what some of the risk factors for periodontal disease is. These don't necessarily cause the periodontitis, but you can be at a greater risk if you have some of these. Age is a risk factor, so the older adults are at more risk for gum disease. Genetics, if you've had a lot of people in your family that have had periodontal disease, then it's likely that you may get it also. Tobacco use, and this can not only be just smoking, but smokeless tobacco also, like chewing tobacco and dip can also be a risk factor for gum disease. And last, systemic diseases. These are like cardiovascular disease or diabetes, because these delay wound healing. And what periodontitis is, starts out as the inflammation. So this inflammatory process is delayed and the healing is delayed. So that is also a risk factor for periodontal disease. Last, I'm going to tell you what symptoms can be seen with periodontal disease. Sometimes you don't have any symptoms. You don't have any pain and you're not sure that you have periodontal disease. But often it starts out with red, swollen, tender gums, which is usually starting out as gingivitis. And then gingivitis, which is inflammation of the gums, is what that means. It progresses into gum disease where you actually lose the gum and the bone around your teeth. You also, like I was showing in the first picture there, recession of the gums, where you're losing that gum tissue and it looks like the gums are shrinking and the teeth are getting longer. They're not getting longer, but you're just seeing more of the root there. Bleeding when brushing or flossing. You really shouldn't get any bleeding when you're brushing or flossing if you have healthy gums. So if you do get that, that's something that you need to see your dental hygienist or your dentist for and let them know that. Or if your teeth are getting loose, that is obvious problem there that you need to see your dentist for. That is a symptom of gum disease also, or periodontal disease. So today I have explained what periodontitis is, what the risk factors are, and what symptoms can be seen with periodontal disease. And so I hope that this speech has given you all the information to ensure that you're not one of the many Americans are fighting this periodontal disease.